Well, thank you all for coming. My name is Malin Mitchell. I currently serve as State President of Professional Firefighters Wisconsin. I also have the honor and the pleasure of serving as the chairman for the Wisconsin Fire and EMS Coalition. It's a coalition representative of 9 different associations from all over the state, stakeholders, and what we call public safety, fire, and EMS. From volunteer to paid on call to career. We're all in this together, and that's indicative of the 150 plus folks that are behind me and the 100 plus state legislators that we'll be meeting with shortly. Our 9 associations are a coalition of groups that, quite frankly, don't always agree on everything. Sometimes we're at the other side of the table. But there is one thing that we agree on, and that is that we need funding in order to adequately do our jobs. And in order to be adequately funded, adequately staffed, trained, and equipped, that requires an investment from our elected officials here at the state as well at the local level. And at a time where municipalities, towns, and villages are strapped for funding, 0% levy limits, shared revenue being stagnant for decades, we are here to tell our story. A story that we love what we do, but we also need to be safe at what we do in order to make our communities safe. And the only way we can be safe is that we are adequately funded. So that's what we're here to tell. It's budget time this time of year, and we're here to tell our story. And first up, for the Fire Chiefs Association, to speak to you today is Michael Stanley, Fire Chief of Oshkosh. Chief.
Thank you, President. My name is Mike Stanley. I'm the Fire Chief for the City of Oshkosh, but also I'm the President of the Wisconsin State Fire Chiefs Association. And I have the honor to stand in front of over 150 fire and EMS leaders that represent the noble, brave, and dedicated members of fire departments and EMS agencies throughout this state, who, regardless of the time of day, the weather, what they may be doing, are willing to sacrifice time with their families to get up from Christmas dinners, to be called out of their stations, to respond. The fire departments and EMS agencies across the great state of Wisconsin are filled with professionals that want to make a difference, that want to care for the sick and injured, to prevent fires. But it gets more difficult every day. As President Mitchell was just talking about, we are suffering and have suffered for many years and are now in a crisis for our public safety to be able to meet those emerging and continuing needs of our community members, to serve them with an essential service of fire and EMS protection because of handcuffs in a broken system. Shared revenue, levy limits, and expenditure restraints are hampering our ability to survive. That our existence, as James Small will talk about in just a few moments, is in jeopardy. That we may have to shutter doors in communities and not be able to respond to that 911 call because of fiscal constraints. And now is the time for us to address this system and to fix this system. That we have the support of the governor, we have bipartisan support from our representatives and senators. The decision makers in this building are now ready and are charged with helping us to fix that system so that these leaders can go back to their agency, to their dedicated men and women in their departments, and give them the resources that they need to save lives every day in this state. So I thank you for the opportunity to speak to you today. I'm honored again to stand in front of these leaders who make a difference, and we're ready to make change. Thank you.
Thank you, Chief. And next to talk about EMS needs specifically around our state is Alan D. Young from the Wisconsin WMSA.
Thank you. Good afternoon. My name is Alan D. Young. I'm the Executive Director for the Wisconsin Emergency Medical Services Association. Our association represents around half of all EMS providers and their departments in our state, just over 7,000 EMS professionals. We are all here today to shed light on the dire situation that are faced by our emergency medical services, EMS, here in Wisconsin. As we speak, EMS departments are faced with a critical shortage of both funding and staff. The men and women in EMS are the first responders to emergencies and play a critical role in saving lives. Yet, today, they are not viewed as essential by our state government. For decades, volunteers have staffed most departments, keeping costs minimal for our Wisconsin communities. With costs of living increases, increased demands on EMS, and changes in our demographic, we are seeing less volunteers now more than ever. Over the last 4 years, Wisconsin has seen a 21% increase in EMS calls. That's over 116,000 more calls every year placed for EMS by our communities without any permanent funding being provided. This number of calls is trending to continue increasing year after year. Due to the increases in 911 calls, the lack of funding, and volunteerism on the decline, many EMS departments are on the verge of collapse. Some departments have been forced to close, some have been forced to merge with their neighbors, and some are even left without 911 service altogether. It is imperative today that our state legislature take immediate action to address this crisis that we are in. We must invest in EMS services on a state level by providing the needed funding to support EMS operations, to train and to recruit, to meet this growing demand on our communities. We're asking our state legislators to provide EMS with proper, permanent funding through the state budget to relieve some of the tax burdens that communities face if no funding is allocated. As a community, we owe it to ourselves, we owe it to our neighbors to ensure that EMS services are well-staffed and well-equipped to provide the best level of care. We urge lawmakers and community leaders to prioritize this issue and take proper action to support EMS funding. Funding needs to be provided by the state to stop this EMS crisis that will affect and has affected so many lives. I'm now going to pass it to James Small for the Office of Rural Health.
Well, thank you for being here. I'm James Small. I'm the Rural EMS Outreach Program Manager with the Wisconsin Office of Rural Health. And I think we've heard the word crisis used a few times. The Office of Rural Health just completed a study of the ambulance infrastructure of the state, and it's fair to say that the results are shocking, but not surprising. Did you know that last year, 41% of our ambulance services didn't operate 24/7, 365 like they're required to? There's a reason for that. We don't have the money and we don't have the people to keep these ambulances operating. 21% of our services are being operated on 2 to 3 people. An additional 20% are being operated on 6 or less. Even if they can find people, they can't hire them, there's not the funding for that. And that's what we're here today. Behind me, we have about 1% of the state's emergency responders down here today trying to solve this issue. And I think everyone wants to solve it. I haven't seen a legislator that's told me it's not a problem. I haven't heard anything from the governor other than they want to solve it, and we want to solve it too. So thank you for being down here and helping us spread the message.
Oh, sorry. Thanks. So we thank you all for coming, those from the media, and thank you for helping to spread our message. We're going to go now and get after it. And the 150 plus folks, thank you all for coming and being here as well, and all the jobs and what we do for the state of Wisconsin. So thank you all. All stay there though, because we got to take a quick picture. So that ends our press conference. That will conclude my TED Talk. There you go.
Thank you. Want the podium out of the way? Yeah.